Welcome to the Alphagenix Podcast, where every week we talk to guests from the field of men's health, longevity, wellness, and biohacking. And today I'm delighted to introduce Ove Indergaard, a physio like me, and one of the co-founders of ED Clinics. Ove, how are you?
I'm very well, thank you, and thanks for having me on your podcast.
No problem. I've actually been really looking forward to this one because if 25 years ago, someone had said to me when I was at university studying physio, in 25 years' time, you and another physio will be on a podcast, which didn't even exist then, talking about erectile dysfunction, I'd have thought they were joking.
Agreed, completely agreed. I mean, it was never an ambition of mine when I first started out. Like most physios wanted to become a sports physiotherapist, and haven't realized that dream and gone as far into that rabbit hole as I wanted to. It's something else. Yeah, it's definitely something I would never have thought so like 20 years ago, for sure.
Yeah, but a really rewarding part of health, isn't it? Men's health in general. Obviously, there's a lot of overlap between what you do and what we do, hence one of the reasons why we know each other. And I guess, how did you end up in it? How did you end up in men's health?
Well, it started with sports, as most things. Obviously, I'm a general MSK physiotherapist as well. And the way I actually got into men's health is becoming an expert within the area of shockwave therapy, which is one of the things we're going to be talking about today. And then as we were going through some specialist training, we were at the factory and the headquarters of Storz Medical, which is one of the biggest manufacturers in the world. They were actually going through and we were having advanced lectures with their experts. And part of this training was learning how to do the erectile dysfunction protocols with the shockwave therapy equipment and things like that. And then that kind of sparked an interest going, okay, well, I've got the equipment in my clinic. I have had people in the past ask about it. Can you do this treatment? And I've always said no, because I was never trained in it. Mm-hmm. And then so that kind of sparked the interest. And I thought, well, okay, well, it seems simple enough, but I need to know more. And, as a fellow healthcare professional, that you can't just take something and just apply it. You need to understand it fully. And for me, that meant actually going and training and doing some training within the men's health field so that I could understand the complete person, because that's what we do in physiotherapy. It's not just the knee pain or the shoulder pain. It's we have to understand the entire person and where they're coming from and all the factors that were influencing the person's problem. And so that became the focus for me. So went and then had some training within that, and then tentatively, spoke to a couple of my clients who had previously approached me and said, I'm now actually comfortable doing this. And that was the start of it. And, since then, it's been a revelation really in terms of how much I've actually enjoyed doing it. And the enjoyment comes out of changing people's lives and really restoring people's, joy for life more than anything. It's an amazing one effect an erection can have on somebody.
100%. It's an erection for a man is tied into our mental health. It's tied into our body image. It's tied into self-confidence. It sounds ridiculous, really, doesn't it? But it's crucial for our health in so many ways. And I think a lot of men go through life, and we know really high percentage of men will suffer with ED at some point in their life. But a lot of men don't know there is help out there, and they keep it to themselves. Their relationship deteriorates with themselves and potentially with their partner. But knowing there are things out there that can help, I think, is a really important thing, which is why I was so looking forward to today. How prevalent is it? Like, do 1 in 10 men get this? Is it 1 in 100? What is it?
Well, it's something I like to tell everybody that gets in touch with me. It's more common than you think. It is quite common, and in the general population, the studies showing some of about 35% of all men have it. But as with anything, as you get older, it's more prevalent. So there are some aging-related changes that happen, and so as you go along, the general rule of thumb is like, when you're in your 40s, 50s, around about 40% of men have it. As you get into your 50s, 60s, it's like 50% of men have some form of erectile dysfunction. This isn't just a tap that turns on and off. It's gradual descent, I guess, of lack of the ability to get an erection, and there are many reasons for that, of course. The most common one is the vascular side of things.
Yeah, I guess if we go back a step, what is erectile dysfunction? Is it just the inability to gain an erection, or is it to do with the firmness of it, how long you keep it? Like, is there a definition?
Well, the definition of erectile dysfunction is the inability to get an erection, and like you've alluded to there are many factors there. Can they get a full erection? So can they maintain that for the duration of intercourse? And what we see in clinic is that there are so many different kinds, as in there are various forms of it. Some people just have they haven't got the full firmness, but they can still have an intercourse. Some people who have a near full erection, but then whilst they're changing positions during sex, can actually lose their erection. We see people who can nearly get a full erection, as in they can't actually get an erection that's hard enough to penetrate. And so then there are people who just don't get an erection at all as well. So there's severity, different grades of severity, if you like.
Yeah. And do you find that men will seek help only when it reaches a certain point in that? Is it when they can't penetrate their partner, for instance?
Well, you've already said this as well. Men don't like to seek help. Men don't like to talk about these things. It's not something that they can open up to their friends about in the pub, or on a one-to-one, because it's tied in with the manhood and feeling like a man, so they feel lesser of a man having these kind of problems, which is completely bonkers because it's just another medical problem. But they don't tend to seek help, and they often ignore it and then just pull away from having intercourse and sex. And there are many things that affects, which is not only their own enjoyment for life, but also their relationships, and things starts to deteriorate. But it's another thing that we get a lot of satisfaction from when people do come and see us. The fact that they feel like they finally have somewhere to speak, but it takes them a long time to actually reach out in the first place. So is there an average? The majority of people that come and see us, they've had problems for 3 years, 4 years, 5 years, and longer. They've usually tried other things. They've usually been on the medication. Some of them have seen the GPs. Other people haven't even dared go and see the GP yet. So there's a lot of counseling in terms of what the next best step for them is as well when we get these people contacting us.
And you mentioned a little bit before that one of the main reasons is vascular. Why is that? Why does that happen?
So, as you get older, it's usually an age-related thing. So as you get older, your blood vessels get some damage, and they tend to get a little bit harder, and they don't actually, around your blood vessels, there are certain things called smooth muscle tissue. And they're not like normal skeletal muscle that we lift weights with. They are usually there to open and close blood vessels. As you get older, they get harder. And they don't tend to expand as much as they normally would do. So you actually have a genuine lack of volume coming in quick enough into the penis. And so that means that there's two main chambers there that need to fill up, and they're not getting enough blood coming into them. Now, there's a magical thing that happens when there's enough blood coming into those chambers, is that they shut off the veins that exit the penis. And so often you don't have enough blood flow coming in to shut off these veins, and therefore you have what's then called a venous leak. There's actually leakage of blood in. So you might have, some blood coming in, which means you get a partial erection, but there's enough blood coming out for it actually to fill up fully and get completely erect. And that's the vascular side of things. The blood vessels tend to get damaged with time. And which is why it gets more prevalent as you get older, because it is an age-related thing. But there are also other conditions that can make this worse. People with cardiovascular disease, they have a kind of a speeded up version of aging in those blood vessels. So they tend to get the problem sooner. So one of the things that we have to screen for is, do they have some form of cardiovascular disease that when they come in to see us? So that either means that we have to get them checked by their GP. We check the blood pressure and things like that, and making sure that there is nothing major underlying, because some people will consider erectile dysfunction because of the size of the blood vessels, so small in the penis. It's almost like the canary down the mine. They actually will show up there before you actually develop problems in the future. So if you start with erectile dysfunction, it's really important to get your overall cardiovascular health checked out.
Yeah, I've heard that before. Where the urologist, Dr. Judson Brandeis, on the first episode, and he mentioned this, that 7 to 10 years after a man develops ED, they're quite likely to have a cardiac event. And I think we've known that for decades, and yet it's not talked about. But this is potentially huge. A cardiac event is not something that we should be ignoring, and yet, as you say, there's a canary down the mine a decade before.
Yeah.
But yes, knowing that link is one thing. Is there anything a man could do about it, or is it just all downhill from there?
Well, there's many things on the market already that that people have attributed to helping with erectile dysfunction. Pumping, the vacuum pumps, which have been around for a long time, they tend to force blood into the area, which then causes some mechanical actual expansion of these blood vessels, and can be a useful way to kind of exercise the tissue, if you like. The other thing that has become very common these days is using the little blue pills, the Cialis, the Viagras, which then actually help to relax the blood vessels by releasing more nitrous oxide within the bloodstream. And so that then forces those blood vessels to open up. Those tablets tend to only work for a little while. And so you tend to then have to have stronger dosage of it to get the same effect, and eventually a lot of them fail. And the next steps from there are to do some injections. There are injections that you can have that has a similar effect, which is stronger because it goes directly into the tissue rather than through your bloodstream. And then the step after that would normally be a penile implant, which sounds quite drastic, really.
Yeah, absolutely.
So, I mean, this is where shockwave therapy is potentially revolutionary, and certainly is a different solution. So shockwave therapy came about many years ago, but 42 years ago, I think, they did the first case of destroying kidney stones. And this was done with a big machine. You were sitting in this big sink bath, and they sent these massive shockwaves into the sink bath, into your low back, which then created a destruction of these kidney stones. And it wasn't a very comfortable treatment, but it did work. And so they thought, wow, we've now got a non-invasive version of destroying these kidney stones. Since then, it's emerged into different types of fields. One of the most exciting ones at the moment is cardiac surgery. So they use them for they shockwave the muscles during the surgery of the bypass graft surgery, and it actually doubles the outcome of the bypass graft surgery in terms of the ventricular function, which is really cool. But what I was alluding to there was that they also used to use it before that for angina. And so in angina, we have a similar kind of problem to in erectile dysfunction, where there's a limitation to how much the blood vessels can actually open. And so they shockwave this tissue that was struggling because of the lack of blood flow into the muscle. And they realized that they can actually start to grow new blood vessels into this heart muscle.
That's amazing. So it's not just improving the blood vessels that are there, it's actually growing new blood vessels.
Exactly. And that comes down to the cellular mechanism of shockwave. But what they basically thought of then was like, well, where else do we need more blood flow? And that's when you have this wonderful translation of evidence going into different fields of medicine. And so you take the evidence from one area and you move it to another, and you apply it, and then lo and behold, they've had the same result happen within the penile tissue. And the reason why it does that is because when you use shockwaves, so if we just mention what shockwave actually is, because it sounds terrible, they've got the worst name ever, but it's to do with physics. So a shockwave basically is a sound wave. In nature, it's like a sonic boom. Okay, a sonic boom is a shockwave, and it's a sound wave that is applied, and it has a really, really rapid rise phase. So it happens really quickly, and within a nanosecond, there's been a pulse up and down onto the cells, and that push and pull onto the cell creates a biological change. It signals to the cells to do something. It's a procedure called mechanotransduction. So you put a mechanical stimulation onto the cells, and that cell then starts to upregulate what it does. And in terms of erectile dysfunction, there are a few growth factors that are released when you use shockwave, which then can start to grow new blood vessels. But not only that, it can actually help those blood vessels that are already become stiff and fibrotic to become less fibrotic and functioning better again. So we have that effect happening, and we also have this new blood vessel formation. So the growth factors then peak. So we would do normally a course of 6 treatments once per week. And for each week, there's an increase in the amount of growth factors. And then around about 4 weeks, that peaks. And then we then monitor the effect of the shockwave afterwards. And that the growth factors are active for another 2 months after the end of treatment. So you're looking for a long-term change. Now, growing a blood vessel doesn't happen overnight, but they actually start to sprout after the first week.
Wow, that's amazing. I guess I knew that it improved the blood vessels that were there, but I had no idea that it actually helped to stimulate the production of new blood vessels as well.
It does.
Mind-boggling. That's actually brilliant. So definitely see, obviously, that can assist with a vascular erectile problem. Are there other types of erectile dysfunction? Well, I know that there are.
Yeah, of course you do.
Perhaps you could tell us what they are, and how do you differentiate them? Because obviously you only want to treat people who you can improve.
Yeah. So there are three main headlines, if you like, in terms of erectile dysfunction, if you like. This is how I try to explain it to our patients. One, you have a psychological element of erectile dysfunction, and this one form of this would be performance anxiety. But there are other things. People who struggle with anxiety and depression, they also have occasional problems with erectile dysfunction too. It's not an automatic thing, but it's something that happens quite commonly. So there's an importance to discuss that with people. The second form is more of a hormonal side of things, and this is what you guys are so good at, is looking at the testosterone function, the thyroid function, and all the other kind of hormonal issues that can actually lead into having erectile dysfunction. And I think the stats are around about 30%, isn't it? 30% of people with testosterone deficiency that has erectile dysfunction, which is quite a significant amount of people.
Yeah.
So if you have either of those two, then it makes it really, really hard to actually have an effect from a vascular side of things. You may have 1 or 2 or 3 of these things ongoing at the same time. So, for instance, I would say 99% of the people that come in to see us have some form of anxiety and depression regarding their condition. I class that as pretty normal. They're worried about it. Their relationship is on the line often, and they're struggling with it mentally. The whole manhood thing aside, but they're also the kind of the whole reality is kind of crashing a little bit because they are so worried about it. And quite a few people have good supportive partners, and that I applaud that. I think that's so important. But often they like to keep it a secret. They don't want to tell their partner in case it doesn't work, for instance, because they don't want to bring their hopes up and things like that. So, that side of things is a huge element of it. So we always need to discuss that with our patients when they come in. But in terms of the medical side of things, the more physical medical side of things, we use screening tools for that. So we have a good long discussion with them. We kind of in a roundabout way talk about all these issues that may be present, so that we can get a good understanding of what's the whole person is like. But we then use our screening tools, and part of the screening tools is, for instance, the ADAM questionnaire, which looks at testosterone deficiency. And if you get a lot of those, you tick off a lot of those boxes on there, we know that there's a high risk that you may have some testosterone deficiency, and we actually send people for testing if that's the case. If there's any underlying, or we think there's some underlying medical issues, we send them back to the GP, and we also ask for blood tests to make sure that they have checked it and cleared it. And we're not happy to carry on a treatment for what would be a vascular problem should there be say a testosterone problem.
Mm-hmm.
Purely because you could improve the vascularity, which they might need, but your testosterone levels, if they're not optimized, then you're still not going to get that same arousal effect, which is so necessary. So then your treatment's not going to be as effective as it could be if you combine those two together.
Yeah, that makes sense. And I guess, as you mentioned there, I would imagine every man who is experiencing this will also have a level of psychological overlay, anxiety, approaching their next encounter with their wife or their partner. Is it going to work? Is it not? That is going to, without a doubt, play on our mind. But I suppose even coming to you or one of the other ED clinics and having that open conversation helps, because it's out in the open then, isn't it? Is that what, do you find, you have that aspect of the treatment as well?
People usually walk in quite nervous, and they walk out quite reassured. And that's a huge part of what we do. You've taken somebody who has been sitting on this information for 3 years. They may have seen their doctor about it, been cleared, but still there's no solution. The medication sometimes work, sometimes it doesn't work, in terms of the pills and things. And they just don't have anywhere to go. They have nobody to talk to. So when they've been Googling and Googling and Googling, suddenly they found somebody who, one, knows a little bit about it, and can then reassure them, can give them some clear advice, some clear steps forwards. So, I would say 30% of the people that contact us, we actually signpost somewhere else. We have a good conversation with them and explain to them reasons why they need to be signposted to something else, before they come back to see us, if they need to see us at that stage. So we have ongoing conversations with people over months sometimes, where we even support people even though we're not treating them, just because they need a sounding board. And I think that's a huge important part of what we do. You kind of, you've become their point of contact, if you like, and saying, no, because I'm not treating you, I can't actually help you anymore. That seems a little bit harsh, when all he needs is a quick phone call or a nice message to say, well done on getting you checked out, and I'm glad you found a solution to it. Because often, if they don't come back to see us, they thank us for the pleasure of actually having signposted them in the first place. Yeah,
just having someone, as you say, with the knowledge and with the skill set to either say, yes, I can help you, or you really, you need to go and try this. That in itself is quite powerful, isn't it? And I think it goes back to, our physio roots, that we're, full of empathy and want to help our patients when they come in. I used to love it when someone came in and they had a bad knee and they left and they didn't have a bad knee.
Yeah.
That was a great feeling. And now in the field of men's health, we're getting similar things as well. So I totally get what you're saying there.
Yeah.
There's a lot of evidence as well, isn't there? You mentioned the little blue pills a few times, and low dose tadalafil, so lower dose rather than a performance dose, is quite a powerful adjunct, isn't it, to treatment as well?
For sure. And this is where the combination things help out. And, if Shockwave is bringing in these growth factors and changes to the tissue, the blood vessels that are there, and trying to repair all of that, the best way to look at it is, if you bring the building sites the materials to the building site, you need something to actually build a house. And that comes almost like we go to the gym and do exercise. You have to kind of use that tissue a little bit. And so the tadalafil then it opens up the blood vessels and makes them work better, and ensures that there is more blood flow going into there. So there's twofold there. One, you're actually getting some work in the blood vessels themselves. But two, to make healing in that tissue better, you also need more blood flow. And so the extra blood flow that you're getting in there because of the tadalafil means that you can actually have a better environment for healing. And so there's the double bubble effect of that. So what they have found is that when you combine the tadalafil at the low dose, as you mentioned, with Shockwave, is actually more effective than Shockwave alone.
Yeah, wow. I wonder if they've ever done a study with tadalafil, Shockwave, and testosterone.
Not that I've seen so far, but
We should do that.
We should do that.
In all seriousness, we could do that. That would be quite a powerful study, wouldn't it?
It would be, and you'd have to have 3 control groups, obviously, but it's definitely something that can be done. You'd have to find the people who are deficient with erectile dysfunction, and then we could do that for sure.
Well, let's chat about that offline another time. That's quite an interesting thing to consider. You mentioned as well about erections, or you likened it to going to the gym, that refill, and that was quite interesting when I first came across that sort of theory that nighttime erections are the equivalent of us going to the gym. So filling the tissue, emptying the tissue is like lifting a weight and putting one down.
Yeah, absolutely. And it's a great thing when a lot of people with testosterone deficiency, for instance, they lose their nighttime erections. So is that a factor then that makes them develop their erectile dysfunction? There's a great study that was done in Finland some years ago, and they looked at the amount of exercise people were getting or how much sex they were having, and looking at the likelihood of getting erectile dysfunction. And the stat was that if you had sex less than once a week, you were 30% more likely to develop erectile dysfunction.
Wow.
So it's kind of a use it or lose it kind of situation. So
yeah. We use it or lose it. We know that from the musculoskeletal system. And that is always true. And the same with this. And I've got ideas now of people watching this podcast back and then taking it to their wife or their partner and saying, see, got to do it at least once a week.
Absolutely, just to make sure it doesn't go away.
Yeah.
It's, but it comes down to that, like you say, exercising that tissue. So, the other thing that happens with that spongy tissue tends to become less elastic as well with age. And that needs exercising too. And so it means moving that tissue. It means keeping it viable and getting the blood flow pumping through there.
Yeah, really fascinating. You mentioned about low T can cause a reduction in nighttime erections. And what's fascinating with that, but as you know, I've taken testosterone replacement therapy for 10 years now. And if you'd have asked me even a couple of years ago if I was experiencing erectile dysfunction, I'd have said no, because I've always been able to perform when necessary. However, in hindsight, I'd lost my nighttime erections completely. And it was only when a colleague of yours mentioned low-dose tadalafil a couple of years ago, and I went on a 12-week course, so that came back. But it was incredible for so many reasons. Like, I hadn't realized how closely linked a morning erection or a nighttime erection was with my mood. I felt strong. I felt better. I felt more masculine all of a sudden just from that coming back. But I hadn't even realized it had gone. It just kind of crept up. And because it still worked when I needed it to, I would have said I didn't have a problem. But it does sneak up on us over time, I think, is probably the...
I'm going to be completely honest with you here, and you know this because we've spoken about this for a long time, but I've been on testosterone supplementation for 10 years myself, and similar situation to yours, never had any problems with performing when needed, but I hadn't noticed that my nighttime erections are gone. And it wasn't only when, about a year ago, I changed the type of testosterone supplementation I was having, that my nighttime erections started coming back again. And they're becoming so bothersome that they're actually waking me up. But it was strange, and I thought, okay, I didn't think I had a problem, but obviously it was on that path downwards, and eventually maybe that would have happened to me as well. But I feel confident now that my testosterone levels is balanced out again, that things are going to just continue to work as they always have.
What I think I find totally fascinating about this conversation is we're both medical professionals working in men's health, and yet both of us didn't realize what was going on with us, with our own body.
That's it. Been treating these problems for years, but never thought I actually had a problem until. But it's so subtle, isn't it? So it's hard to know whether it is a factor or not. You know, mostly, you know, how many nighttime erections do you have? Was it 16, 17 or something like that? You know, I don't wake up 16, 17 times a night. You know, it's just a case of never knowing that they were there or not. And yeah, it's amazing, isn't it?
It really is. And one of the other benefits I found with tadalafil as well is you get that increased vascularization when you go to the gym as well. So, you notice the vascularity in your arms more, which makes you try harder in the gym. And I go to the gym with my wife, and I'll be going, look at my arms, you know, when I'm doing certain exercises, but it pushes me to try harder. So actually, I've found it hasn't just helped with erectile function as well, but it's had this overspill into my general health and well-being as well.
Okay.
So I think it's been really interesting. My wife just laughs.
Maybe I need to try that.
Honestly, I found it because I did my original 12-week trial last year, and I'm in my next 12-week trial now. So the plan is to do one trial a year just to keep things working. And it's the same now, you know, so we go to the gym and I'm like, wow, look at that. Look at my arms. So lots of benefits, I think, you know, as you said, you know, erectile problems, but it improves cardiovascular health, I think, in general. I can see a future where men are having this routinely over the age of 40 to combat problems as part of a preventative treatment program. And I know we've talked as well about Shockwave being used preventatively as well. So where does that sit with the current research? And if anyone's watching this and thinking, can I use it before there's a problem?
So, I mean, you know, the first thing to mention is that shockwave therapy is a non-invasive treatment. It's completely safe. So over 40 years of using this therapy, across the whole body, there is no side effects to it. There's very minor side effects. And in terms of your penis, I've not seen any side effects whatsoever. There's no pain during the treatment. There's no discomfort, and it's a perfectly safe treatment to do. So obviously, the mainstay of the people that we treat are people who already have erectile dysfunction. But if you're getting into your 40s and you're starting to notice that there's a little bit less power in that, it's not filling up completely, but you can still perform really well, then it's perfectly okay to come and have the treatment, and it should continue to work for you. It should still work at that level, and it's much easier to change something when you're already functioning really well in terms of your general health. So, you know, the people who have more success in our clinic, or easier, quicker success, are probably the people in the 40s as opposed to when you're in your 60s. And we see rapid changes. So, you know, one chap that I discharged yesterday, he's in his early 40s, had problems for 3 years, and within his course of treatment. So we talked about how these changes can actually happen over weeks and weeks. Within these 6 treatments, he's actually regained his function. So that happens in not many people, but it usually happens in the younger population. So in terms of prevention, if you're starting to notice that there is some change, it isn't quite as full, it isn't quite as hard as it used to be, then having what we'd call almost like a booster treatment is perfectly viable, and it should work much quicker than the standard course of treatment. So you might only need 3 or 4.
That's fantastic. And I know, we've talked a bit about this before, but I'd love to see a future and soon where, you know, there are a place where you can go to have all of this preventative medicine, you know, in a short period of time. So maybe they're having their biomarkers measured for their hormones, and they're having the low dose tadalafil, they're having the shockwave, having educational lectures on masculinity and general health and how to lift properly in the gym, and all of these factors, you know, that come together to make a man a man. I think there is definitely a gap because we don't seek help. It goes for too long. I I would love to see that, where there's just this space where men can come and learn about all of these things and have it if they need it.
It could open the floodgates, couldn't it? You create a forum for people to actually come in and just learn about these things. You might find that there's more people than you actually think that actually need the help.
Without a doubt, and hopefully even people listening and hearing us talk quite openly about it will help people, because there are so many negative connotations about some of the things we've mentioned. Penis pumps, for instance.
Yeah.
That for me, up until probably quite recently, I always thought of that more as a sex toy, not as something that can help a man's penile strength.
Yeah.
Viagra, that I think often gets abused by people, and actually it has a preventative and very genuine reason for helping people, but could it be used in a better way?
Well, I think this is part of the reason why we set up ED clinics. So ED clinics is a national network now of clinics. The co-founders are all people who teach shockwave therapy. So I'm one of the tutors here in the UK, and I also teach in the US for people how to use shockwave therapy. And there's a group of us. And so we decided that we wanted to set up a more professional outlook that we could then market to people, to open people's eyes that there are possibilities for help out there. So we've been working on this for 3-4 years now, and the brand is becoming much more established. We're getting much more people reaching out to us. But the underlying thing there is making sure that the care is that full-centered care that you talk about, that it's based on the latest evidence, that the best equipment that is needed to actually create these changes are being used. And we're trying to quality control that. And we work together as a group as well to learn from each other, so that we harness everybody's experience. And the power of that group means that we've come a long way in these 3 to 4 years. So, there are basic protocols that, anybody can get hold of. They can't get hold of what we do in our protocols, because we have refined it and how we utilize the different things and the partners that we have within our group that make it much bigger than what it actually is, if you like. But yeah, so it's a national network that was set up purely for quality control and improving the patient care.
Brilliant. So how many clinics are there? How far would somebody have to travel if they...
So currently there's about 7 clinics where we're looking for new partners. It takes a little while to find those partners, because we want to make sure that the quality is there. But 7 clinics throughout the country. The furthest north is Edinburgh. The furthest south is Portsmouth. And then we have everywhere in between. So there's London, there's Kent, there's Suffolk, Birmingham. I'm based in Leeds, and then we have a Liverpool clinic as well.
Yeah, fantastic. And you mentioned it didn't hurt, because that's always going to be one of the questions, isn't it? We tend to be quite mindful of our private parts.
Yeah.
So it's like, is it going to hurt? I don't want to do it if it's going to hurt. What other questions do you get? Early doors. What are the barriers that stop people coming to see you?
I think the first thing is literally that they're worried about speaking to anybody about it. Once you overcome that hurdle, which we tend to do on that first phone call, because we're quite relaxed about it. We talk about these things all the time. And when people realize that it's a normal thing to talk about, they open up quite quickly. They want to know if it hurts. Is it going to fall off afterwards? And those things don't happen. So that's quite easy to talk about. And then, they want to know how quickly can they see results. They want to know that it's effective. It's, it's not a new therapy. It's been around for a long time. And in erectile dysfunction itself, it's over a decade that it's been used now. There's plenty of good research studies out there showing that it does work. And so we rely heavily on that evidence to be able to counsel people on it. And we know there's different patient groups that do better, and we can tell them quite well the probability of success based on the research that's already out there.
That's amazing. And when people come, do they say, who's going to treat me? Like, are all your therapists men, for instance? Like, do men find it easier to talk to a man, or would they rather talk to a female therapist?
Well, through our clinics, we both have males and females within these clinics. In my clinic, there's only males that do it. Occasionally, we do get a request saying I'd be more comfortable with a female rather than a male. But when we mention that we don't have one, there's usually not a problem. I think essentially they just want to be comfortable with the person that's been then the treating. And once they've been through the first treatment, their shoulders just drop, they relax, and they go, that wasn't so bad. And then they come in with a big smile on their face the next time. And we usually become quite friendly, towards the end. We talk about all sorts of things during the treatment session, to almost distract from what we're actually doing.
Yeah, absolutely. And you said some people can get improvements within the first few sessions.
Yeah, so some people do see some changes. I wouldn't say the majority of them see the changes during the sessions. The majority probably see it, afterwards, only because these changes take weeks to happen. A cell changeover takes about 12 weeks. So if you stimulate a cell to do something and it signals a growth of a new cell, for instance, that takes 12 weeks to change one cell over from another. So these things do take some time. But we are stimulating nerves function down there. We are stimulating some anti-fibrotic action. So that means that it becomes less hardened, the tissue that's there, and that happens much quicker. So we have studies that show that can happen after just a single treatment, that the hardness of tissue, whether that's ligaments or tendons or muscle, actually becomes softer immediately after treatment. The mechanical stimulation on it can release certain things that then creates a tissue that's more pliable and more elastic. So some people do see changes quite early on. Part of that is literally from the other effects, not the vascular effects of the shockwave.
Wow, that's brilliant. And what about, do you talk to people about their diet, their lifestyle as well? Because obviously that can have an effect. And I think we're seeing more and more younger men with problems now, aren't we? Potentially because of the environmental factors, poor quality food. So do you talk about that, or do you just leave that to one side?
I'm glad you mentioned it, because it's so important. When people come in to see us, and often people have underlying issues that leads to erectile dysfunction, let alone the young guys who obviously have some form of lifestyle issues too. But we always talk about it because it's so important. I tried to touch upon it a little bit earlier in terms of creating that right healing environment inside your body, and having better blood flow into the area is vital. So what we tend to tell people is that they need to start exercising. If they're not already exercising, they need to exercise more, purely because the better your body is able to transporting blood around your body, the better all tissues are going to function. And that's the same with the food and stuff. So we get people to try to think about their diet. We don't tend to prescribe a diet, but we tend to talk to them about the things that they might be doing currently that they could do better. So diet, exercise, alcohol use. We talk to them about porn. Using porn can have a detrimental effect on your ability to get an erection. And so we tend to talk to them about that and explain to them that there are ways and means that you can come off that, and quite quickly after stopping the use of porn, you can see some big changes. 3-4 weeks down the line, purely from not having that hyper arousal that occurs with these images.
Wow. Why does it cause? Why would it cause a problem?
Well, the problem with porn, and this isn't the occasional use of porn. This is abusing porn, as in they're using it several times a day sometimes. And so when you use porn and you have these hypergraphic images, they create a kind of a pleasure response within your body, a dopamine response, where your body is releasing certain hormones based on the stimulation of the visuals that you're having. So if you're then used to 4 or 5 times a day having this hyperstimulation to be able to get an erection and then to have an ejaculation, when you then go into a normal situation where those images aren't there, you have your loving partner that's there who might not be performing like the images that you've seen, or the stimulation isn't quite as dramatic as you would see on screen. That becomes a problem for the brain. So it just downregulates, and it doesn't actually get the same arousal effect. So it's almost like an addiction where you need a stronger and stronger kind of stimulus to get an erection. And so, the people tend to go further and further down that rabbit hole and need more extreme versions of porn to kind of get that same stimulation. So yes, it's quite a topic on its own, and there's some nice books written on it if anybody's interested in reading about that. But the good news is that if you can counsel them and make them realize that this is actually detrimental to your performance, then if you actually stop it, be really hard on yourself and don't do it for a few weeks, your body will then go back to normal again within the month sometimes. And so that means then that when you go into your normal situation, again, you will appreciate that and be aroused as you would do because of that one-to-one interaction.
Wow, that's really fascinating. But I guess it kind of makes sense because the internet now gives everything at our fingertips. So it's super easy to have access to pretty much anything you want. Whereas, pre-internet, that wouldn't have been the case. So
yeah, and we often see this in the younger population. They have this access to the internet, and they've grown up on the internet. So, it's quite easy for them to get into that kind of a habit.
Yeah. Wow. That's really, really interesting. So it's basically, it's more common than people know.
Yep.
It's more complex than people appreciate. There isn't a magic pill. Well, there is a magic pill, but you can't just rely on that. But there are lots of things people can do. They can improve their diet. They can improve their exercise. They can use the low dose magic pill, perhaps to great effect. They can use penis pumps. But also people need to be aware of the work that you're doing at ED clinics as well. And Shockwave is something that can be used to improve and also prevent this from being a problem.
It certainly can. And I think, like you mentioned how good it would be to have somewhere where people can come and have, everything done, their blood's done and looked at, do they need the testosterone stuff? Can they have some Shockwave while they're there? Can they get education on how to train properly to improve their general health, but also on improving the natural production of the hormones which happen with good exercise? That would be an amazing thing to do.
Yeah, I think giving people that knowledge and sharing that this is something that is, 50% of the population of the world have a penis. The other 50% know what one is. It shouldn't be a big deal to talk about it. I think if we can get the message out there that this is just a medical issue, as you said earlier on, and have people talk, we could prevent so many problems. I mean, I can think of a few people, and you'll know many, many more, who were having this type of issue, weren't talking to their partner. Their partner then wrongly assumed that because they were pulling away from them, they were having an affair, and their relationship was deteriorating because they weren't communicating about it. The man was embarrassed. The woman put two and two together, or the partner put two and two together and got 27 because of this lack of communication. But if we can talk more openly, people like yourself, people like us, everyone, hopefully we can get to the stage where men feel comfortable talking to their partners. And I think one piece of advice maybe to put out there is, if your partner says they have a headache more than a couple of times, gently ask if there's anything going on, because it could be they've got ED and they don't know how to talk about it.
Yeah, and I think the other thing is that change starts with one person, right? So if you think about your friendship group, you might have 10 men that's in your friendship group. If 35% of those people have some form of erectile dysfunction at any age, then 3 of your friends are struggling.
Yeah, that's powerful in itself, isn't it?
So if you can, in your friendship group, have an open conversation about it, then things can change.
Yeah, definitely can. And hopefully our conversation today will help people as well. So how did people contact you if anything you said has resonated?
Yeah, so our website is edclinics.co.uk. I think below in the show notes, there'll be my personal website as well for my clinic in Leeds. for edclinics.co.uk. There's lots of information about the treatments that we do. We don't only do treatments for erectile dysfunction, which is something that we haven't mentioned. We do it for chronic pelvic pain problems. We talk about, we shockwave for Peyronie's disease, which is an abnormal curvature, and also for more newer conditions like hard flaccid syndrome, which is as a side effect of what we talked about, the porn addictions and excessive masturbation, etc., etc. So there's many more conditions that we can treat, and there's information about all those on the ED Clinics website. And in there's also a list of all our clinics, and you can contact the clinic that's closest to you.
Amazing. And we can't leave it there though. What is hard facet syndrome?
Well, it's a funny one because it's a autonomic response within the body. So that means that it's like a subconscious response in the body where your body hasn't got a hard erection, but it hasn't managed to reduce the amount of blood that's in there as well. So you walk around with almost like a permanent semi, where the penis feels a little bit rubbery, and it sometimes has sensation changes with it. Sometimes it just feels a little bit cold. There is definitely some neural side effects from there. There's always tension within the pelvic floor muscles. So sometimes people have pain within the pelvic floor muscles with this as well. And it's a quite a complex condition, really, but it's some that's been more and more diagnosed. So it's becoming more prevalent as more people know about it.
Wow, that's incredible. And I think we maybe have to get you on again to go into what else Shockwave can be used for, because that sounds like we could go off for another hour there.
There's certainly enough information about it, yeah.
Well, I've loved every minute of our conversation, Ove. Thank you so much. If there was one thing you could leave to anybody watching this, one piece of advice, what would it be?
Hey, don't be quiet. Don't just suffer with this in silence. Reach out to somebody. Your GP is trained to talk about these things. They may not be the expert on it, but if you talk to them about the problems that you're having, they should be able to signpost you somewhere. If you wanted to speak to, I guess, either of us, reach out. And even if we can't help directly, we can, signpost them to the next best person who might be able to help them. So it's just taking that first step of not suffering in silence.
Yeah, brilliant. Great advice. Ove, it's been a pleasure. Thank you very much for your time and have a great day.
Thanks for having me on. Cheers.